Diastasis recti is the partial or complete separation of the rectus abdominis or six-pack muscles. These muscles meet at the midline of your stomach. When the muscles are together, the abdomen is flat. Partial or complete separation of the muscles can make the abdomen protrude. Diastasis recti is very common during and following pregnancy. Correction of diastasis is one component of a tummy tuck. These muscles, once separated, can be difficult, if not impossible, to repair with exercise alone. Some patients come in saying that they feel like they still look pregnant. Even women with low body fat, good skin tone, and good muscle tone elsewhere on their body can have diastasis recti. During an abdominoplasty, I can bring the muscles back together, creating a flat abdominal wall. I then remove excess skin and fat as needed to provide a smooth contour to the abdomen, which can make women actually come down several sizes in their clothing. Diastasis recti repair alone won't make a woman lose any weight, but it can shrink the waist size significantly and give the appearance of weight loss. The muscle repair is performed internally, so there are no visible incisions on the surface of the abdominal skin, aside from the lower abdominal incision that's used for skin removal and the incision used to reposition the belly button.